So it's truth time with Randox Health. Today we're going to look at 5 of the most common questions and misconceptions people have asked us about Randox Health and set the record straight. Number 1, is blood testing not just for sick people? Are blood tests only needed when you have symptoms or feel a health problem? Well, this one is 100% false. Just because blood tests used to be hard to run, not accessible to everyone, only ordered by doctors and medical facilities, hard to interpret, expensive, does not mean the world is still like that. In fact, it hasn't been for years. Look at ordering taxis, watching TV shows, and phoning someone in another country. That all got pretty different over the last 10 years too. The earliest signs of a health problem will arise as tiny imbalances in your blood. And innovative blood tests are now easily available and accessible at Randox Health, direct to consumer. To measure these, interpret them for you, and report your patterns and data back to you in a report that is your very own personalized health plan to guide and explain to you what's working well inside you, what needs some attention or improvement. In fact, your blood results when you are sick in medical care are often in disarray due to the illness, and they're not a good indicator of your general well-being. Everyone should have a comprehensive set of bloods run when they're feeling healthy. This gives you your scientifically established personal baseline to work from, and then you can monitor improvements and repeat this every year to identify and fix problems as soon as they arise. Second question is Randox Health the same as most other health checks? As long as you get a good health check, you're doing good? Nope. Oh, so very different. Let me count the ways. So finger prick blood tests, online, postal, mail-in saliva kits, genetic profiling for £100, single cholesterol test here, diabetes test there, are in no way comparable to Randox Health. Neither is standing on scales or checking your water and muscle levels. Just take all those off the table to start with. The health checks that you get with your insurance companies or employer, well, they haven't changed in 20 years. These are not really looking to find anything wrong because then they would have to help you fix it and pay for that. The government and National Health Service screenings, these have been available for decades, but in light of these, why are we all still getting sick, living with chronic conditions and dying from the same things, I might add? Therefore, I deem these screening programs to be ineffective in solving the problems too. However, there are some useful additions like scans and examinations that you can, of course, add on to your Randox Health Check. Finally, the longest standing standard health check providers that have been on the market the longest, and you've likely had a few times in your life already, well, these are health checks, yes, but the number of tests haven't gone up or changed much in years. It's just the price you pay that's doubled. And I can say that we've had people opt for these every year before Randox Health came on the market. And when they came to Randox, they gained findings and information, solutions that they'd never had known before, and therefore had missed out on years of prevention. But now, with Randox Health, this is different. This is a game changer. This is money well spent. This is suitable and beneficial for everyone. Number 3, why do we need so many tests? Surely that's more to worry about and more to find wrong. So no, this is not like asking so many questions until there comes a point when the more answers will be wrong than right. In fact, it's the opposite. By gaining enough data to rule out the source and signs of problems, you're actually finding yourself to be healthier in more ways than you could have previously known. Let's imagine we're in a gorgeous art gallery in a beautiful city in Europe, and we're walking around fabulous works of art, and I have had one large frame completely covered in brown paper. Imagine we stood in front of it and I said to you that you could pluck 5 holes in the brown paper. And when we did, I asked what you could see. Very little. We agreed you could pick another 8 holes out of the paper. Still couldn't see much of what was going on in the artwork behind. So you pluck 10 more and 10 more holes and 10 more. The more the paper that you can uncover, the more of the image that you can discern to understand what's going on in the scene on the artwork behind. This is Randox Health uncovering the brown paper with a huge data set extracted from a tiny sample of your blood. And this is how we get as many answers as possible to know what's good and what's showing up as on the decline as well. Number 4, the question is, I'd rather not know. It's daunting waiting on results, and what good can come of so many tests? Well, one piece of good news, as this person is clearly a worrier, Randox Health has had now released that there will be a same-day service coming soon. The proprietary Randox biochip array technology used on-site in the labs at Randox Health clinics can rapidly release results with the intelligent reporting system same day. Right now, it takes a day or two. This is already much faster than many other clinics that have to send your blood samples out to huge laboratories and wait on them reporting back. So many tests means so many answers, and these are the routine tests plus the more innovative new tests. We are able to check out the standard warning signs and or diagnoses of common diseases, but to also use the innovative tests from Randox to measure the smaller, more sensitive biomarkers in your body that rise and fall before you even have a disease to diagnose. These are the pre-symptoms, pre-illness, prevention markers that are actionable, meaning if you know what's out of range, you can focus on improving these and therefore prevent diseases developing. These tests also rule out anything sinister happening from having this deeper level of intelligence accessed within your body. So just monitor all of the data sets regularly for peace of mind. These have come from 30 years of scientific tech and engineering at Randox for you to feel in control and not fearful. Number 5, why are Randox Health scientifically led? Do I not need a doctor to choose my blood test for me? Total respect for doctors, but how can any human look at you and tell you what 12 blood tests you need to find out what's both right and wrong with you? There's about 20 symptoms people feel, and many of us don't even notice them to report in on time because we're used to long, hard days or simply the numbing of life. There's over 13,000 diseases and more than 750 potential blood tests, so there's no mathematician or superhuman that can calculate which you need or when. Bottom line is, measure everything comprehensively. Track your personal results on an ongoing basis. Your Randox Health report becomes your personal instruction manual for what's going great inside you and what needs closer attention, with a few changes to get it back on track and get you out of your risky zones. Scientists research, develop, manufacture, engineer, and conduct this biotech and this testing at Randox. They're the experts in scientific well-being. They choose to offer this service direct to the consumer, and we can all benefit from it now directly. We can go to Randox Health and get our data, DATA. That's direct access to answers. We are so happy to answer any and all questions that you might have about Randox Health. Simply write in below, subscribe to the channel, watch our videos, and we'll be happy to answer your questions the next time.